Uh, a very good afternoon to one and all. Today's topic of discussion would be on radiation protection. So, the question arises, where does this radiation come from? I mean, what is the source of the radiation? Most of us already know that we are exposed to the natural source of radiation or the background radiation, what we call, as well as the artificial source of radiation. The natural source of radiation is usually the cosmic radiation or your ultraviolet radiation and the terrestrial radiation that we are exposed on in the basis of the background radiation. Then we have of radiation, especially the artificial radiation which comes from medical field as well as the consumer products wherein the radiation is used. So with this background, let's also understand the amount of radiation that the different types of radiations that contribute to the global exposure. In that the majority is, as you can see, from radon, which is almost 52%. The man-made radiation exposure, usually the nuclear medicine, the consumer products and the nuclear fuel cycle, the medical and dental diagnosis is also a matter of concern when it comes to the exposure of radiation. So with this background, dear friends, let's understand why it is necessary to protect, from what we need to protect, whom to protect and how to protect. So these are the things which we are going to learn from this lecture today. It is important to protect from radiation because radiation, as you know, causes ionization of our biological tissues, thereby causing damage, both physical as well as in the form of biological damage. So we need to protect whatsoever form of radiation. We need to protect one from this exposure as far as possible. And whom to protect, especially when we are using the artificial source of radiation for diagnosis purpose in medical and dental field. The people who are concerned here would be the patient protection, the operator protection, and the people who are in and around this source of radiation that we need to protect. And how to protect? Yes, there are various measures to protect the operator, the patient, as well as the general public from the source of radiation as far as possible. So when we talk about radiation protection, the International Commission on Radiological Protection has formulated few principles. One is the principle of justification, and then is the principle of optimization and dose limitation. We'll understand what is principle of optimization. The principle of optimization says that although we need to use radiation for various reasons, we need to follow the principle of as low as reasonably achievable. So an attempt should be made every time to avoid unnecessary exposure of the radiation to the patient as well as to the general. The ALAR principle has to be followed by all the radiation workers, occupational workers, as well as for the public also. So the annual effective dose should not exceed more than 1 millisievert for the public. For radiation worker, it would be somewhere around 50 millisieverts, and a woman radiation worker who is in a reproductive age or who is also pregnant should not exceed more than 10 millisieverts. Just next, coming to the principle of justification, as far as radiation protection is concerned, we should always selection of the patient is important for radiation exposure, as well as thorough examination of the patient prior to radiation exposure also equally. When coming to the selection of the image receptor, one needs to select an image receptor which is highly sensitive to radiation, thereby reducing the dose of radiation to the patient. Normally we also use a combination of screen and the screen films and intensifying screens, especially when we take an extraoral radiograph, in order to reduce the radiation dose to the patient. And nowadays the digital imaging has really come up with the drastic radiation dose reduction to the patients following this technique. Now when we talk about the radiation exposure, what is of more concern to us is the source to skin distance. So as we know, from the basic principle of, or the the property of the X-rays, that the X-rays are divergent from the source of their origin. So, and also we know that the X-rays follow the property of inverse square law, that is, the intensity of the X-rays reduces, or it is inversely proportional to the square of the distance. So, as the distance increases, the intensity reduces. So, with this knowledge, we should follow these rules in our practice. Another thing is, since I told you in the beginning that the radiation is always divergent from its source of origin, so collimation that is restricting the size of the beam also helps to reduce the radiation exposure to the patients. So use of rectangular collimation is always advisable for radiation protection for our. Next part here is the filtration. Filtration is filtering the low energy X-ray photons from the beam. Thereby unnecessary exposure to the skin and tissues can be avoided. So when we are using a machine, IOP machine with 60 to 70 kVp, and effective filtration of 1 to 1.5 mm has to be achieved in order to be safe enough so that the low energy X-ray photons are filtered out. Similarly, for X-ray machines which are operating above 70 kVp, one needs to use up to 2 to 2.5 mm of thickness of aluminum filter. Now, use of position indicating devices is also recommended as far as radiation protection is concerned for our. Film holding devices drastically help us to improve the quality of the image as well as reduce the problem of angulation defects in your resultant radiograph. So thereby reducing the repetition of the radiograph. One needs to also use the various radiation protection the equipments, like you have the lead gloves and the thyroid collars. The thyroid collar with the thickness of 0.2 to 0.5 mm of lead is very advisable, especially for young ladies because of to avoid the exposure to the thyroid gland, which is the most sensitive part in the head and neck region. Lead apron, again, with the thickness of 0.25 mm lead inside this apron is recommended to be worn while exposure, and especially in a pregnant lady, if it is really advisable, indicated to take a radiograph, use of lead apron to avoid exposure to the fetus is always recommended. So along with this, one has to follow a proper technique so that avoiding the repetitions and unnecessary exposure to the patient, proper processing of the images, as well as interpretation of an ideal way of interpreting the image also helps to avoid unnecessary radiation exposures or repeat radiographs for your patients. That was about the protection to our patients. Coming to the protection to the personnel, that is radiation worker. The most important aspect of protection to the radiation worker would be one needs to follow the position distance rule. In this, the operator has to always maintain a distance of 6 feet away from the source of X-rays, source of radiation, at an angle of 90 to 130 degrees, because this is the most suitable position in order to avoid any kind of secondary radiations reaching the operator. This distance rule is applicable when you don't have any radiation protection in the form of, say, a barrier in your setup. So at a distance of 90 to 130 degree, as you can see in this image, the secondary radiation reaching would be minimized. The radiation dose to the operator or to your staff can come basically from 3 forms of radiation. One is the primary beam, if the operator stands in the path of the beam. Second is the scattered radiation from the patient, or sometimes if there is any radiation leakage from your machine itself, can also be the cause for radiation exposure to the operator. So the barriers should be there when you are operating with the X-ray source, and this should contain a leaded glass window to enable the operator to view your patient during the radiation exposure. So always better to stand behind an lead protection and use a lead glass window in order to visualize your patient while you do the exposure. And even the place where the radiation is used, the room and the walls should be constructed of gypsum wall board, are adequate. Usually this is adequate for our dental use. So I always recommend to use a rectangular collimator whenever it is available, and proper use of film placement technique and exposure as well as processing should be followed. So adequate protection with the leaded apron for the operator as well. Okay. Neither the operator nor the patient should hold the radiographic tube housing during exposure. Whenever it is possible, it is required to hold the film. You should ask the patient himself or herself to hold the film. Okay. So never hold the suspension arm or never hold the radiographic, the X-ray machine housing while you are doing radiation exposure. Now, another important aspect of radiation protection for the operator would be monitoring the radiation exposure, because the operators would be exposed to radiation day in and day out when they are working in a radio diagnosis department. So, personal monitoring devices, commonly referred as film badges. Then there are other forms such as thermoluminescence dosimetry, ionization chambers. These all, dosimeters can be used in order to monitor the radiation exposure for the person over a period of time, and then thereby taking adequate measures to avoid exposure above the recommended dose. So coming to the third aspect of radiation protection, that is protection of general public. And general public in the sense people who are there sitting in your waiting room outside your radiology department should not be exposed to radiation inadvertently. Okay. So the ionizing radiation regulations have changed over a period of time. For classified workers, the new dose limits would be 20 millisieverts. For non-classified workers, it should be 6 millisieverts in a year, and for general public, it is almost 1 millisieverts per year. So another important aspect of radiation protection is when a pregnant woman requires a radiograph, the legal person must ensure that the dose to the fetus to any pregnant member of the staff is unlikely to exceed 1 millisieverts during declared term of the pregnancy. So the justification should be reviewed to ensure that only radiographs that are absolutely necessary are taken. Example, delay the routine periodic checks if it can be done. The patient should be reassured that a minimal dose is being employed, and the patient should be given the option to delay the radiographic exposure if it can be done. Protection of the environment, especially when we talk about the primary beam, never direct to any other person when you are doing radiation exposure. X-ray beam is aimed at wall, not at the door when you are doing the process of taking an IOPA or occlusal or extraoral. The walls of your radiographic room should be 3-inch in concrete, and wherever it is required you can use lead also, and windows should have a lead barrier, not to be targeted to the primary beam. Lead glass should be used, especially when you are using a lead barrier. A lead glass should be used so that you can visualize your patient while you are doing the radiation exposure. So with these measures, one can achieve reasonably less radiation dose exposure to the operator as well as to the patient as well as to your surroundings, thereby following the radiation safety measures. Thank you one and all for your patient hearing. If you have any questions, you can ask. Thank you.